Let's discuss face reading, neurasthenia. Neurasthenia is a neurological condition caused by long-term excessive mental stress, excessive mental burden, or traumatic experiences leading to a host of clinical symptoms due to a brain dysfunction. Common clinical symptoms include emotional instability, pain due to tension, mental hyperactivity, fatigue, sleep disorders, and autonomic dysfunctions. Neurasthenia is a mental illness closely related to long-term depression, excessive worry, and anxiety and mental stress. Face reading. The tongue coating is pale with thick impressions on the tongue edge. In the Earth's heart zone, circular folds can be seen and a flaky white patch can be seen at the anterior earlobe zone of the ear. The eyes usually have dark circles and the eyelids are puffy and there are red blood streaks in the eyes. As illustrated, the circular folds in the ear and a flaky white patch at the anterior earlobe zones of the ear. The next illustration is a dark circle under the eyes. Therapeutic methods. Neurasthenia is mainly caused by one mental state, so the patient should learn to self-regulate, avoid mental stress, and get enough rest. Soaking the feet in the warm water before going to bed can promote blood circulation and help you sleep better. Soaking the feet in the warm water before going to bed can help you sleep better, as illustrated. Dietary advice include more foods that replenish the brain and clear the heart in your diet, such as Crucian carp, lotus seeds, or longan. Do not drink strong tea or other caffeinated beverages at night. Exercise. Do physical exercise to enhance your physical fitness, such as running, jumping, aerobics, swimming, and playing badminton. Emotional adjustment. Learn to self-adjust, confront whatever is unsatisfactory and stress-inducing in life with a positive attitude. Cultivate an optimistic, open mindset, balance your work and rest, and do not overexert yourself. Medicinal diet therapy, chicken soup cooked with tall gastrojet tuber. Okay, one chicken tall gastrojet tuber, 15 grams, dried shiitake mushrooms after soaking, 50 grams, chicken broth, 500 ml, and some green onion and ginger. Wash and slice the tall gastrojet tuber and steam for 10 minutes. Cut the chicken into pieces, stir fry with the green onion and ginger, add chicken broth and bring to the boil. Then turn to low heat and keep simmering for 40 minutes. Add tall gastrojet tuber slices and simmer for 5 minutes and the soup is ready. Tall gastrojet tuber, whose property is to calm the nerves and tranquilize the mind, helps relieve the symptoms of neurasthenia. Massage. The Bayou point has the effect of clearing the orifices, refreshing the mind, soothing the liver, and expelling wind. It mainly treats neurasthenia. Massaging the Bayou point for 3 to 5 minutes with finger of your choice. Every day can relieve the symptoms of insomnia, dizziness, and headache caused by neurasthenia. Thank you for your attention. Let's discuss interviewing female sexual function. Sexuality, while not an overripe gynecological issue and not an issue that is traditionally inquired about, a woman's sexual desire and functionality can reveal important information. It is not a question always asked. Some clients, though, do give information that is relevant to the rest of the diagnosis. It is important to maintain the client's trust and respect and not overstep their boundaries. A woman who has with tinnitus may not see the relevance of being asked about the moistness of her vagina and could feel violated. Sexual desire. Our sex drive or libido is governed by the flaring up of the Mingmen when it is activated by heat from the heart. It is cooperation between the imperial fire and the ministerial fire. This is dependent on both the heart and kidneys being balanced. When we are sexually aroused, there is an increase of heat in the body. This requires yang. The increase in heat is seen in the cheeks, lips, nails, and so on, becoming red, and the skin feels warmer when we are aroused. Heat and yang from the heart and Mingmen fills the genitals. Clear and unimpeded communication between the kidneys and the heart and a strong kidney yang are essentials. If kidney yang is weak, there will be a lack of libido due to the lack of heat from the Mingmen. If kidney yin is weak, it will not be able to control the heat in the heart, and there may be an excessive sex drive. Heat in the heart can also rise from other sources. If the heart is deficient, such as when there is sadness, for example, the heart will not activate the Mingmen. This is typically seen in relationships where a woman believes she has lost her sex drive. If this relationship ends and she finds a new partner, often there are no longer problems with her libido. Liver chi stagnation may also play a role in lack of libido, because when liver chi stagnates, there can be a stagnation of chi on all levels. Lack of self-confidence and low self-esteem may also be factors that affect the heart chi. Orgasm. Liver chi plays a major role in the orgasm and controls the muscles in the genitals. If there is liver chi stagnation, a woman may have difficulty achieving orgasm. Her stagnant liver chi causes her to have difficulty letting go. It often becomes a vicious circle. Orgasm are an excellent way to release stagnation of chi. Chi accumulates more and more until the orgasm liberates it. If the woman does not achieve an orgasm, there is only accumulation of chi without release. This in itself will stagnate liver chi. At the same time, it can be emotionally frustrating not to achieve an orgasm. This will further stagnate liver chi. A lack of yang can also play a role. There needs to be sufficient yang heat to create sexual arousal and desire in the first place. To create an orgasm, this heat must be sent down from the heart. There is not enough yang, or if the heart is weak, there can be difficulty in achieving orgasm. The headache can arise immediately after the orgasm, can be a sign of ascending liver yang, rebellious chi in the chong mai, or heart fire. This is because the sudden release of chi will rise up to the head. Vagina. The liver channel traverses the area around the genitals, and its loop channel runs to and through the vagina. The stagnant liver chi can cause the muscles in the vagina to become so tense that intercourse is painful or not possible, such as when there is vaginitis or vulvodynia. If there is kidney yin deficiency, the mucous membrane becomes dry. Many menopausal women suffer from dry mucous membranes in the vagina. This is because yin and blood have dried out in the renmai, which passes through the vagina. This will result in the mucous membranes of the vagina not being lubricated. The Dry mucous membranes can also be seen in younger women who are kidney yin deficient or blood deficient or when heat has damaged yin yin. Now, the table of female sexual function. On observation, with lack of libido, the significance is kidney yang deficient, heart chi deficiency, heart yang deficiency, liver chi stagnation. Excessive sex drive, the significance is heat. If there is lack of orgasm, it means liver chi stagnation, yang deficiency, heart chi deficiency. Those with headache immediately after orgasm means ascending liver yang, rebellious chi in Chong Mai, heart fire. Tense vaginal muscles means liver chi stagnation. Dry vaginal mucous membranes means yin deficient, blood deficient, and heat. Thank you for your attention.
Let's now talk about third gu, joining of the valleys of the Han-Yang-Ning large intestine meridian. Li4 of third gu on the dorsum of the hand between the first and second metacarpal bones, radial to the midpoint of the second metacarpal bone. Li4 is the source point, the entry point, one of Madame Yang's 12 points shining bright as the starry sky, one of the 9 needles for restoring yang. Li4 is one of the classic points of acupuncture. As a yuan source point, its connection with the origin is harmonizing and regulating for body, mind, and spirit, relieving anxiety. The great self-regulating capacity of yuan source points helps balance the large intestine either when it has become bogged down in the modalities of life, seeing only the coal face and never the diamonds, the endless practicalities of life, or when at other times large intestine has become detached from the world, walled in by memories, resentments, or perhaps too deficient in energy to move on in life. When out of balance, large intestine can find it hard to connect with others, even when help is needed. The instinct to do it their way and be defensive can lead to tension, often exhibited along the pathway as well as in behavior. This can be eased by Li4's connection with the Yuan Qi, allowing large intestine to relax and move. It strengthens Qi and Wei, or the defensive Qi. Li4 is a powerful point. As the entry point, it invigorates and regulates the Li meridian and food. When pain originates from the intestines or areas traversed by the Yang-Ning channel, Li4 can act as a powerful antispasmodic muscle relaxant. The combination of Li4 with liver 3 is known as the 4 gates and is commonly used to treat pain, spasm, and tension of body, mind, and spirit. Tuagbu's ability to move and tonify the blood can strengthen muscle tension along the Li channel and strengthen atrophied muscles. The name Great Illuminator indicates the function of the large intestine not just at a physical level, but also at the level of mind and spirit. Whatever the system has become blocked, constipated, and toxic, it can help restore balance, showing as over-refining verbal diarrhea or endless pedantry. Like lung 7, this point can prompt an emotional release, but it engenders calm, equanimity, and regularity of the automated rhythmic processes of life that, under the aegis of the Po, keeps us in harmony with life. Li4 is sometimes called the command point of the face and mouth. This meridian directly affects the face and sense organs. Tuagu is often used as a distal point for mouth, nose, and eye problems on the face pertaining to the Yang-Ning channel, often in combination with Li20. Li4 is a major point to release the exterior, clearing heat, wind heat, and fevers. It strengthens the dispersing action of the lungs to release the exterior and expel wind. and is often combined with lung 7 to clear external wind. Li4 is one of the 9 needles for returning yang, so it's used as a revival point after a collapse of yang. It harmonizes the ascending of yang and descending of yin, recalling the power of metal to balance, and can be used to balance ascending rebellious qi of the stomach, the lung, or the liver, or to raise sinking qi. Li4 is indicated for a headache with a swollen face, malarial fevers, burning and cold, tooth decay or a nosebleed, locked jaw. When unable to speak, the needle enters 5 when deep. The patient then immediately at peace. It is also indicated for pain along the Li channel, for toothache, conjunctivitis, mouth ulcers, nasal congestion, sneezing, hay fever, sinusitis, trigeminal neuralgia, frontal headaches, and facial paralysis when the yang-yin channel is indicated. It is also for constipation from stagnant Li Qi. It is the empirical point to induce labor and is forbidden to needle during pregnancy. It is used for needle shock in acupuncture first aid and at the toxification point with bladder 59 and is used in clearing the toxins of addiction, alcohol, drugs, and for chemotherapy. A classic, powerful, and frequently used acupuncture point. As with any source point, it can be used to test for the CF and also to support or augment the effect of other points on the meridian. It helps rid the body, mind, and spirit of garbage which may have accumulated over many years. When combined with bladder 59, it can have a marked effect of further removing toxins from the system. Both points have the additional name of great eliminator. The patient may experience a physical or emotional discharge after treatment as it eventually brings calmness to the system. Forbidden throughout pregnancy, this point assists the patient in letting go on all levels, but especially with sadness, grief, or a sense of loss, thus allowing in those things of value. Consider for problems in the face and mouth, such as migraines, headaches, toothache, earache, or nasal congestion. When used with liver 3, a protocol known as the 4 gates, this point can have a wonderful effect of calming the patient on the levels of body, mind, or spirit, and this strengthens the defensive qi. Thank you for your attention.
Differential diagnosis of premenstrual syndrome. Premenstrual syndrome is a collection of physical, psychological, and emotional symptoms that occur in relation to the menstrual cycle and which interfere with a woman's life. Symptoms usually appear 5 to 11 days before the start of menstruation and stop when menstruation begins. Signs and symptoms: feeling irritable and bad-tempered, feeling depressed, feeling emotional, headache, breast tenderness, feeling bloated, weight gain, poor sleep, poor concentration, backache, acne flare-ups, constipation or diarrhea, food cravings. Other signs and symptoms are anxiety, confusion, forgetfulness, aggressive behavior, loss of libido, fatigue, decreased self-image. Causes: exact cause is not fully understood, but thought to be linked to the changes in hormone levels, which occur throughout the menstrual cycle. Women with low levels of serotonin may be more sensitive to the hormone of progesterone. Incidence affects about 95% of women of childbearing age. Between 5% and 10% of these women will have severe enough symptoms to call it PMS. Chinese differentiation of premenstrual syndrome. Diagnostic questioning according to 8 principles and pulse, primarily access if stems from emotional problems, wiry pulse in all positions or only on the left, or from phlegm, primarily deficient if secondary to deficiency of liver blood, liver yin or liver and kidney yin, fine weak pulse. Type of PMS with irritability, depression, crying, abdominal or breast distension, stagnation of liver qi, nausea or vomiting before the period, liver qi invading stomach, co-cycle disharmony, premenstrual constipation, liver qi invading intestines and spleen, Shang co-cycle disharmony, premenstrual headaches, stagnation of liver qi or hyperactive liver yang, very swollen and painful breasts may indicate phlegm, edema, spleen kidney yang deficiency, co-cycle disharmony. Etiology, emotional strain, anger, frustration, and resentment stagnates liver qi. Poor dietary habits, phlegm from dairy or greasy foods can combine with liver fire to create phlegm fire. Overwork, excessive sexual activity weakens liver and kidney yin. Zangfu patterns. Excess patterns are stagnation of liver qi and phlegm heat harassing the heart. Deficiency patterns, liver blood deficiency, liver yin deficiency, kidney yin deficiency, kidney yang deficiency, and spleen yang deficiency. Thank you for your attention.
Let us now go to auscultation. The topic is cough. Coughing is one of the main symptoms of lung diseases. The pathology of coughing is somewhat complex, but in any illness, cold heat and deficiency strength can be differentiated by the sounds of the cough and the accompanying symptoms. If the sound of the cough is heavy and muffled and the sputum is white, the cough is mostly due to exogenous wind cold, so that lung qi is sent abnormally in retrograde fashion. If the sound is soft but clear, reflecting hesitant qi movement, the cough is mostly due to chronic deficiency of lung qi, so that its dispersion and depuration functions are impaired. If the sound is low with yellow and viscid sputum, the cough is due to either wind heat attacking the lung or massive accumulation of heat in the lung. A dry cough without sputum in a new illness is mostly caused by exogenous dryness injuring the lung. A dry cough in a chronic illness is mostly caused by sustained deficiency of lung yin. In an infant, sometimes there may be coughing that comes in fits, each fit consisting of rapidly repeated coughing and is like one long sustained cough followed by inhalation that resembles the whoop of a heron. This is whooping cough, also known as the 100-day cough. It is caused by turbid phlegm impeding the air passages so that lung qi cannot move smoothly. Spasmodic cough resembling the bark of a dog is commonly heard in diphtheria, also known as white throat. It is due to a pestilential poison transmitting internally with fire attacking the throat. The sound of the cough and sniffles will determine its significance. If the cough is loud with the sound of loose sputum, that is wind cold with damp phlegm. If the cough is loud with sputum that is difficult to expectorate, that's lung heat with phlegm heat. A barking cough is lung heat with phlegm heat, and a loud and explosive cough is an excess condition. Dry or ticklish cough is lung yin deficiency, and a weak cough is a deficient condition. And the sniffles is wind cold or damp phlegm. Thank you so much for your attention.
Recording in progress.
Let's now proceed to diagnosis according to Zangfu organ patterns with the etiology of liver imbalances. Due to its dynamic ascendant and expansive energy, the liver is adversely affected by limitations. This is particularly evident on the mental emotional level. All kinds of frustration, irritation, and suppressed or unresolved emotions will stagnate liver qi. It is the ability of the liver and the hun to have a vision and a goal whilst also having the dynamic to move towards this goal, which is the liver's strength. Unfortunately, it is also its weak point. Frustration and thereby liver qi stagnation arises every time you are prevented from doing what you want to, and every time you are forced to do something you do not want to do or do not like. That is, each time the hun is prevented from fulfilling its vision. When we live in a society with other people, we will constantly be impinged upon by other people's visions and ideas. This means that you will, to a greater or lesser degree, have to make compromises and not do what you would ideally like to. Every movement in life is either towards what you want or what to do, or away from what you don't want or don't want to do. It may be that you are trying to achieve some goal, or it may be that you are trying to avoid something unpleasant. Each time you are blocked in this movement towards pleasure and satisfaction, or away from suffering or pain, it will stagnate the liver chi. There is a significant difference between how much your vision or ideal of yourself and your life is obstructed, and how much you will be subjected to other people's vision of how much you can determine your own life, or the number and size of the compromises that you have to make. It can be anything from having to live with a tyrannical husband, or having a boss who humiliates or harasses you, to having spent Sunday afternoon with your in-laws, do the washing up, or just stand in a queue. Anything that prevents you from doing or being what you want, or being where you want to be, will stagnate liver chi. The extent to which these things can stagnate a person's liver chi is also determined by how good they are at accepting the circumstances of their life. Two people faced with the same intransigent situation will have different degrees of dissatisfaction depending on their ability to accept the reality they are confronted with. This is important to remember when treating chronically ill patients. Being ill and not being able to live life as they would like, whilst having physical or emotional pain, will stagnate a person's liver chi. This means that even though liver chi stagnation was not necessarily a part of their diagnostic picture in the beginning, it will often have become an element of their imbalance dynamic by the time that we meet them in the clinic. Anger, which is the feeling or emotion that has a resonance with liver and the wood phase, can affect the liver negatively in two ways. Anger has a very strong yang dynamic. Anger causes liver chi to ascend upwards. This means that anger can aggravate and trigger conditions caused by ascending liver yang or liver fire. On the other hand, because anger is so dynamic and powerful in its energy, it will have an equally powerful stagnating effect on the liver chi if it's not expressed. As well as consuming qi and yin, stress can have a stagnating effect on liver chi. This is because stress can be extremely frustrating. It is said that stress does not arise from all the things that you have to do, but from all the things that you don't have time to do. Frustration at not achieving your objectives and goals, as well as feeling impatient, will stagnate liver chi. Stagnation of liver chi combined with the consumption of the kidney and heart yin, which is often another consequence of stress, can lead to the generation of heat in the body. Thank you for your attention.
Inspection, diagnostic significance of colors, blue and red. These 5 colors not only reflect abnormalities of the respective internal organs, but also the different natures of the pathogenic agents. Pathological changes in the interior of the body can be inferred from observing changes in the patient's complexion. A blue complexion suggests cold, pain, blood stasis, or epilepsy. The blueness is mostly due to impeded flow of qi and blood, constriction of the vessels, and the blockage by blood stasis. Clinical correlates of blue complexions. Bluish and pale would be associated with exogenous cold invasion, endogenous yin cold. Blue-grayish with cyanosis of lips will be accompanied by chest pain and tightness, associated with suppressed heart yang, impeded blood circulation, stasis of heart blood. Cyanotic complexion is accompanied by chest and subcostal pain, is associated with impeded flow of lung qi, stagnation of liver qi. Cyanotic complexion, especially nasal bridge between eyebrows, accompanied by infantile high fever, associated with aura of convulsion. A red complexion suggests heat and fire. Deep red suggests strong exogenous heat or fire, and light red suggests interior deficiency heat. Red is the color of summer and blood. Its chi is summer heat, and it is associated with the heart and the small intestine. When blood is warm, it flows. If the warmth becomes excessive, blood will fill the capillaries in the skin, causing redness of the skin. This is the reason why flushing is usual in illnesses due to heat. Clinical correlates of red complexions. The whole face is bright red, and a glow is associated with exogenous fever, interior heat due to excess of visceral yang. Malar flashing is associated with yang excess due to yin deficiency. Periodic glow with rouge-like flushing, mild redness with some pallor that shift unstably, is accompanied by pallor of critically or chronically ill patient, associated with false heat due to the excessive yin in lower body and rootless yang rising into the upper body. Thank you for your attention.
Let us now go to epigastric pain. The topic is liver qi invading the stomach. Epigastric distension and pain radiating towards the right or left hypochondrium, belching, sighing, irritability, uncomfortable feeling of hunger. The pain comes in bouts clearly related to emotional tension. Those are the clinical manifestations of liver qi invading the stomach. The tongue will have a normal body color or slightly red sides, and the pulse will be wiry, and it may be wiry only on the left side. This is an extremely common cause of epigastric pain. Stagnant liver qi invades the stomach horizontally and impairs the descending of stomach qi. This results in stagnation of qi in the stomach and epigastric pain. From the 5-element perspective, it is called wood overacting on earth. Liver qi stagnation is usually due to emotional problems such as anger, resentment, or frustration. The treatment principle is to soothe the liver and regulate qi. The points to be used are liver 14, pericardium 6, stomach 21, REN 12, stomach 36, GB 34, using the reducing or even method. In cases of severe emotional tension, we can use pericardium 7, triple burner 3, DO 24, and gallbladder 13. Pericardium 7 and triple burner 3 can be used unilaterally, one on the left and the other from the right side. The explanation for the acupuncture points used is that liver 14 is specific to harmonize liver and stomach. Pericardium 6 regulates liver qi, harmonizes the stomach, subdues rebellious stomach qi, and calms the mind. Stomach 21 stimulates the descending of stomach qi, especially in excess patterns. REN 12 and stomach 36 tonify stomach qi, and strengthened stomach qi prevents it from being invaded by the liver. Gallbladder 34 soothes the liver and eliminates stagnation. In combination with REN 12, it eliminates stagnation in the epigastrium. Pericardium 7, triple burner 3, DO 24, and gallbladder 13 is a combination of points that is very effective in eliminating stagnation of liver qi and calming the mind. Whenever there are severe emotional problems, especially if associated with relationship difficulties, it is particularly indicated for women, and in men it is better to replace pericardium 7 with heart 7. As dietary advice, in stagnation of liver qi affecting the stomach, it is important to advise the patient to eat slowly, avoid working or discussing business while eating, and most of all, avoid getting angry while eating. Thank you so much for your attention.